Okay, let's go ahead and get started. I pulled up week 4, so okay. Can y'all see my screen? Not yet. Okay, let's get started with week 4. All right, today we're going to be going over an eyebrow lift, and then we're also going to be talking about micro needling, and then we're going to talk about employee discounts and touch-ups, and then we have our marketing ideas for the week. So let's talk about an eyebrow lift. So whenever you're doing an eyebrow lift, the muscle that you are actually going to be treating is the orbicularis oculi muscle. So just kind of recap, the orbicularis oculi muscle is a circular motion that goes all around the eye. It is a syncytial muscle, meaning it normally is a depressor muscle. It goes in. Whenever you put neurotoxin into it, it then relaxes it and it makes it open up. So when you treat right underneath the eyebrow, kind of into that either tail of the eyebrow or in about a centimeter in, it's going to automatically lift that eyebrow up. So you can see what it did for this patient. So this patient, it looks like she was treated with more of a medial eyebrow lift than a tail, because the tail looks about to be in the same spot compared to the medial aspect of the eyebrow. So they probably just did one unit directly underneath that 1 centimeter in. Let's look at a quick video that will pull up.
Most people have no clue that in 2024, the best way to make money with Amazon is not with physical products.
I recently posted a video on how to do a brow lift, and many of you asked questions on how I was able to inject underneath the eyebrow and not cause an eyelid ptosis. Now, unpacking this is a very interesting way of understanding the anatomy because, of course, we are all very afraid of causing eyelid ptosis. Now, many years ago, when I first started training, I remember training an ophthalmologist who told me that they injected the eyelid close to where I was just warning my trainees to be careful of injecting. And they used 4 units, so 4 times more than I would normally use, and he'd never had an eyelid ptosis. And this really got me thinking much more about the anatomy. So by the end of the show, if you watch it all, you should understand the nuances of different muscles and how they are differently affected to what you may have first thought when you first learned how to inject Botox in this area. So many people were concerned that my injection points were so close to the eyelid that I may cause an eyelid drop. Now let's first consider what actually happens if you inject the eyelid. So people have purposefully injected the eyelid with toxin, and you'll be surprised to find out, if you didn't know this already, that what will actually happen is your eyelid will actually lift. And that is because the superficial muscles that are in the eyelid are actually the protractors of the eyelid. They are not the retractors. So the retractor muscle is the levator pulpebri muscle, which runs in the orbit, and this is what we are concerned about not injecting. Whereas the orbicularis oculi, which actually runs in the eyelid, if you inject that, actually allows your eyelid to open slightly, because when you close your eyes, it's contracting, you relax it, it actually opens. So it's actually the reverse of what many people think, because they haven't thought about where the muscle that lifts the eyelid actually lives, which is in your orbit. So understanding this is the first thing around why you don't need to worry too much around eyelid ptosis. But there are other elements too, because of course we can get eyelid ptosis from injecting superior to the eye. So we need to think about what injections are likely to be causing that and what we can do to avoid it, and why my style of injection in my career has never caused an eyelid ptosis in any of my patients. So that's part one of what to understand. We need to think about which muscles are likely to be involved and what injecting toxin actually does to them. If you're injecting superficially and you inject orbicularis oculi, you will find the eyelids actually more likely to lift. In fact, it's now a treatment for eyelid ptosis when you've injected the other muscle, the levator pulpebri muscle. Knowing precisely where these muscles are and what layer they're in will give you confidence to inject in areas where other less thought out clinicians will think you're going to get an eyelid ptosis. So let's think about the layers in this area. Obviously at the top you have the dermis, then you have a thin layer of fat in the hypodermis, and then you have the orbicularis oculi muscle. Underneath that, there's the retroorbicularis oculi fat pad. Then you have the orbital septum, and underneath that you have the preseptal fat pads, and underneath that you have the levator pulpary muscle. So there are actually multiple layers. So to help you understand this, let's think about the face and the anatomy in this area, not with all the difficult medical terms, but just as a sandwich. Imagine that you're having a sandwich on your mum's favorite tablecloth. That represents the most precious part of the anatomy, the orbit. We don't want to get ketchup on the precious tablecloth. And of course, if you make your sandwich directly on the tablecloth, you're going to make a huge mess and cause your mum a lot of upset. Or your dad, might be your dad's favorite tablecloth too. But what we actually do in real life is you have layers that protect that tablecloth. We have a placemat on top of that. You could think of the placemat as the preseptal fat pads. And on top of that, you have the plate, which you can think of as the orbital membrane. On top of that, you have your first layer of bread, which is the retroorbicularis oculi fat pad. On top of that, you may have the meat, the muscle. On top of that is where we try and put our ketchup. And one layer on top of that is the dermis. So actually, the ketchup is shielded from the tablecloth by multiple different layers. And it's exactly like that with injecting botulinum toxin. We're actually injecting tiny amounts just on top of the muscle, and we have multiple other layers shielding those important structures in the orbit. And it's the depth of injection rather than the position relative to the eyelid that keeps those internal structures safe. Another question that we got many times was, how many units do I like to place in the dots underneath the eyebrow? I find it really helpful using just a 1 unit dose, and this is enough to get a difference. I'm not necessarily trying to paralyze the bulk of the muscle. I just want to affect those fibers that are pulling the eyebrow down. This is also a safer amount. It's a bit like, to go back to our analogy, like using less ketchup. You're just less likely to get an inadvertent mess. So small amounts, wherever you can use them, are always safer. As a general rule of thumb, the dose response curve is less likely to cause you a problem. So that's why I use 1 unit. I typically use 1 to 3 units underneath the brow, and then I'll use my stronger doses where the licensed dose is higher at the lateral canthus. In terms of dilution, I usually use the standard dilution of 2.5 mils in 100 units of botulinum toxin, but sometimes I'll use a more concentrated form if I'm in an area where I just want to make sure there's less chance of a spread. But I used to do that a lot more than I do these days. I've had so few complications that I very rarely use different doses. When I do use the more concentrated version, it's in the lower face. Injecting the depressor angularis oris or the mentalis, I feel safer using a more concentrated dose. For most of the rest of the face, I dilute 100 units with 2.5 mils of bacteriostatic saline. Another question we got was, does the brow lift occur from injecting below the eyebrow or also from injecting above the eyebrow? And in fact, years ago, I had patients who would come and say, no, I've had an eyebrow lift, the doctor injected here, you have to do the same in order to get a lift. Now, if you think about the anatomy, this cannot be true because these are the elevators, and if you inject the elevator of the eyebrow, you're going to decrease the power of that muscle to lift. So you're actually more likely to get a drop. And in fact, most of us are very afraid of injecting directly above the eyebrow in the frontalis muscle because that is where you lose the eyebrow arch. So you only get a lift when you affect the little tug of war that's going on with the eyebrow between the two muscles. One's an elevator, one's a depressor. So if we weaken the depressor, which is the orbicularis oculi muscle, and you can see this because if you want to lower your eyebrow, shut your eyes very tightly and you will see your eyebrow comes down, and that's caused by orbicularis oculi. And the frontalis muscle does the opposite. So the tug of war is won by reducing the strength of the depressor, which is orbicularis oculi, not by treating the frontalis muscle above it. However, the other way we create eyebrow lifts is by increasing the resting tone of the lateral frontalis muscle. And this is done when we treat the middle of the frontalis and the lateral gets more active. So in some of my videos, you'll see that I draw cat ears, we call them, and I tell injectors generally not to inject in those cat ears. Now, those cat ears represent the elevating part of the frontalis muscle. So when I say that it reduces the chance of a ptosis, I'm talking about a brow ptosis, not an eyelid ptosis. And this is one of the biggest confusions that happens earlier on for people, is differentiating between a drop in the eyebrow and a drop in the eyelid. And nearly all of the cases I get sent are actually drops in the eyebrow, not in the eyelid. The actual eyelid is stable, but it's rested on by a heavy eyebrow, Typically, if they have extra fat above their eyes and that's resting, or they have an eyelid shape that just naturally transmits energy into the eyelid, it confuses injectors. But that is all to do with reducing the strength of the frontalis muscle in this crucial area that elevates your eyebrow laterally. So the more botulinum toxin that you place in this area, the more likely you're going to have that problem. And so particularly in females and not so much in males, I don't treat that area because I want there to be an eyebrow arch. Females also tend to use their eyebrows in a different way to men, which is to do with applying makeup. Every morning, if you apply makeup, you tend to lift your eyebrows up, whereas men do not notice the loss of movement laterally. So you can actually treat men quite often with more Botox in the cat ear and weaken the frontalis muscle all the way across, and it does not cause any problem or concern at all, whereas a female will miss that ability to raise their eyebrows and apply makeup. Other injectors were concerned by not treating the cat ear area that you may then cause a Spock brow. And in fact, this could be part of a Spock brow. Typically, I think of a Spock brow as a medial brow ptosis and a lateral brow lift. So if you overtreat the middle and undertreat the side, then absolutely you get this disequilibrium, and you have too much activity and too much heaviness in the middle, and that creates this unpleasant shape. So it is possible that you could be on that spectrum. Like everything we do, you're trying to make the adjustments to get a happy medium. So I want a little bit of a brow lift, not a huge one, and I adjust that sometimes by putting one unit in the top of that triangle of the cat ear, and that's typically what I'll do when I know the patient or when I'm confident that they have quite a strong frontalis. I will treat within the cat ear area. I think sometimes people see these markings and they think it's a definite no-go area. It's actually not. It's just an area that I'm more cautious of injecting, and it's helpful if you know you're creating an eyebrow lift, and if you don't know the patient, to start with leaving it undertreated and then to treat them at a follow-up and then make a note of where that treatment was. So then you have a plan that will work each time you see them. But the first time you treat someone, particularly if they're a little bit older and brow drops a little bit more likely, it just makes sense to see what happens with those units, get the result back in 2 weeks, and then make an adjustment, learn from it, and then you can repeat safely whatever you learn from that patient in the first course of treatment. So I hope that's helped you understand in more detail the three important muscles, particularly with respect to eyelid drops. So we've got the levator pulpary muscle, the orbicularis oculi muscle, and the frontalis muscle. And if you take away anything from this, it's the three-dimensional injection depth that matters most in terms of safe injecting around the eye.
Okay, do y'all have any questions about that?
No.
Perfect. Okay, let's talk about microneedling.
Why are women everywhere choosing AbEx, the new tummy tuck alternative?
I got the tummy tuck result.
So the video that you're going to be watching is directly from the manufacturer of MD Needle Pen. MD Needle Pen is the exact microneedling pen that we use. So this is the pen used by MD Anderson in all of their clinical research for skin cancer patients. And so we wanted to make sure that the medical device that we were using was top of the line. And so it is used for aesthetic purposes and for medical purposes. And this is going to kind of go through everything for you.
What is microneedling with the MD Needle Pen? Microneedling, also known as collagen induction therapy, stimulates the body's natural healing process by creating microchannels on the surface of the skin. This procedure leaves the top layer of the skin intact, allowing for shorter healing time and the ability to treat many different skin concerns. Each microchannel allows for the absorption of serums, hyaluronic acid, and PRP when used during the treatment. The body is stimulated to fill these microchannels by producing collagen and elastin, resulting in smoother, firmer, and rejuvenated skin. The motorized technology of the MD Needle Pen has the ability to adjust the sterile needles to depths ranging from 0.25 to 2.5 millimeters. These variable depths allow for the treatment of deep wrinkles and acne scars, in addition to delicate areas around the lips and eyes. Microneedling is an effective treatment for many skin concerns, as we can see by analyzing these real-life before and after photos. Before treatment, observe that the acne scars are very deep and pigmented, but after microneedling, the skin is smoother and pigment is diminished. Notice the pronounced smoker's lines here before microneedling. After treatment, the lip lines and wrinkles are minimalized. Here, we see increased skin laxity and rough texture before treatment. Once microneedled, the skin is tighter, firmer, and smoother. See the sun damage and uneven tone in this patient's skin before treatment? After microneedling, pigment is lightened and the skin tone is more even. Notice the brown spots, wrinkles, and skin texture before treatment. After microneedle therapy, aging skin is less crepey with reduced dark spots. Before treatment, we see stretch marks that are very dark and highly visible. After needling, they are smoother and the color is less prominent. Before treatment, there is a noticeable shortage of hairs on the scalp. After skin needling, the number of hair follicles is dramatically increased. Clinical studies have shown microneedling as a safe and effective alternative to ablative laser treatments. With no thermal injury to the skin, a short healing time, and the ability to treat any skin type, it is a skin transformative procedure for every person. Clinical specialists designed the MD needle pen with durable stainless steel outer shell for reliability and gave it the ability to be used corded or cordless for flexibility. The surgical-grade stainless steel needles are individually sterilized for patient safety and comfort. MD Needle Pen is committed to patient results and has developed unique advanced protocols from actual in-office procedures. To learn even more, we have a clinical study underway with Shriners Hospital for Children for the treatment of hypertrophic burn scars. Microneedling is a safe and effective skin rejuvenating procedure that uses the body's natural cellular regeneration to stimulate collagen production. If you are interested in this unique anti-aging treatment that tightens, lifts, and smooths the skin, visit us at mdneedlepen.com or contact one of our local practitioners.
Quickest way to smooth wrinkled skin. Moisturizer helps your skin, right? Nope.
Okay. Any questions about microneedling?
I had a question.
Yep, go
Sorry.
ahead.
For the Botox party, what is the price of microneedling?
So it is, let me pull it up. On the Facebook page, you also have access to the price list. I have to look it up every single time. So let me pull that up for you and I can tell you exactly where to find it because I can never remember offhand. This list. All right. So if you go to your onboarding page and click search and do price list, it'll pop it up. It looks just like this.
Okay.
And I'm going to tell you exactly how much it is. So for, remind me, are you Texas, Louisiana, Virginia?
Texas.
Texas is for the glow. Remember, the glow are the three primary ingredients, and that is HA, vitamin B12, and vitamin C. It is $379. For the liquid gold, it is those three ingredients plus two more, and that is neurotoxin. And then also we put sculpture in it, and that price is $595 for that. And we typically recommend a series of three. So let's talk about employee, that's supposed to say discounts, not die accounts, but employee discounts. Whenever you are an employee of My Face Lady, you receive a 55% off of all of your personal treatments. Please charge yourself the appointment fee every single time though, because that's how our payroll works is if you don't charge yourself the appointment fee, it's going to take it out of your paycheck. So please make sure that you drop the pin for the appointment fee for that. So please make sure you do, otherwise it's going to show up as a negative on the other end. So 55% off, which really means you're just paying for the price of the product, which is excellent. You can either inject yourself if you feel comfortable doing that. Hold it a second. I'm going to grab that. The other option is you can reach out to some of your other local injectors and y'all can inject each other, whatever you feel more comfortable doing. So it took me a long time before I felt comfortable injecting my own crow's feet or doing any of my neurotoxin. And so if you do not feel comfortable doing it, please reach out to any of the other injectors and y'all can all kind of get together and inject each other. All right, let's talk about enhancements versus finesse versus failed toxin. So these are three different things. A failed toxin is you go ahead and you inject a patient and the toxin 100% did not work. This is where before and after pictures are really important because we actually have to submit those pictures to the manufacturer because it means the bottle is bad. This will happen if the product gets hot or if someone injects the product and the vacuum seal is broken, then the product will not work at all. So please reach out to us. We will 100%, the patient will not have to pay to be re-injected. We do need the before and after photos so we can submit it to the manufacturer though. So just know that. A finesse treatment is, let's say you went ahead and you injected someone and then 14 days later, it cannot be before 14 days. 14 days later, the patient has a little Spock eye or a little brow ptosis, and you just need to go ahead and pop up a little bit. For Botox and Jeuveau, it's 4 units free that they do not pay for. And for Dysport, it's going to be, remember, 10 equals 4. So it's 10 Dysport units. And this is just for little small touch-ups. Now, an enhancement, what this is the patient just needs more. Really, at the end of the day, what this enhancement is, this is for the patients that whenever you initially inject them and they might be on a budget or you don't do full dosing, then the patient is just going to have to pay for more units. So no, full dosing for the glabella for Dysport is 50 units. For the forehead is 35 units. If you do not do full dosing and then the patient comes back 2 weeks later and you're like, I think they might need 30 units instead of the full 50, and you have to go ahead and inject more, the patient is going to have to pay for the additional units. Does that make sense to everybody? Go ahead and give me a thumbs up if it does, or if you need further clarification on that. Yes.
So quick,
Go ahead,
quick
Addie.
question. Okay. So on if they needed we had our launch party. So if they needed like a small touch up, do we make them an appointment and then let y'all know? And then that's how we track our like
Correct. The
whatever.
product. Yep. You go ahead
Right.
and you make the appointment and you do everything. You can do the still do an appointment fee on it, but it will actually subtract it. So it'll zero it out on the other end. But it is totally free to the patient. So the patient doesn't have to pay anything.
Okay.
And that's up to 4 units for Botox and up to 10 units of Dysport. So just know you always have that in your back pocket. But if a patient's like, hey, I'm on a budget, like I can't do 50 units of Dysport in my glabella, I can only afford 30. And then they come back to you 2 weeks later and they're like, yeah, I think I need more. They have to pay for more.
Okay.
Right.
Okay.
And also you get paid on the enhancement. You do not get paid on the finesse.
Okay.
Okay. Did that clarify everything for y'all? Yes. Good.
Yes.
Moving on. Okay, let's talk about our marketing homework for the week. So you are going to be following up with the salons that you have reached out to. A lot of y'all have started having your launch parties, which is super exciting. And then you're also going to post a before and after of an eyebrow lift. And I have that graphic for you. I will post the homework along with that graphic, so you can simply just grab it and post it to your social media page. And then you are also going to come up with your own education post about the benefits of microneedling. So you're going to post 2 times on social media. One I will provide for you. The other one you will come up on your own. And it can either be a written thing that you're doing. It can be a live. It can be a video, whatever you want to do. The world is your ocean as far as what you want to create. And then you're going to, this is when you're going to start or you're going to continue your social media following of additional people that you're going to follow. The first one's going to be Ninja Injector, and the second one is going to be Aesthetic Injector Tawny. Now, these are both a little bit more advanced injectors, and so you're going to see a little bit be exposed to more advanced techniques and advanced procedures. But again, I want you to be a sponge and try to learn anything and everything that you can now that you're inside of this world. Okay? All right, well, that is it for this week. We are going to go ahead and wrap it up. I'm going to stop the recording real fast.